Now let's talk about diagnosis through the nose color. As the entrance to the respiratory passage, the nose connects the inside of the human body directly with the outside world. Many acupoints are located on the surface of the nose. At the onset of an illness, the color and the physical form of the nose will change accordingly. Those tiny changes can help people diagnose for themselves what ailments are developing. Diagnostic nose reading refers to the method of observing the color and luster of the nose, its physical form, and behavioral changes in the course of breathing to determine the underlying ailment. It is an important component of TCM diagnosis. The nose is the orifice of the lungs and the entrance to the perspiration passage. The 5 internal organs all ascend their chi to the nose. A prime example of all visceral organs and tissues in the body. Each Zhang and Pu organ and tissue shares a corresponding site on the nose. For example, the tip of the nose reflects the health of the spleen. If the tip of the nose is red or shows some abnormalities, it may indicate problems with the spleen, as shown in the picture on the top page 42. The different parts of the nose correspond to the related Zhangfu organs on the nose. They reflect systematically and selectively the physiological and pathological conditions of the viscera. In this diagram, we see the points on the face where the lung, the breast, the heart, the gallbladder, the liver, stomach, and spleen are all pointed to the distribution of the corresponding Zhangfu organs. Now, the color of the nose. The nose is one of the more complete and visible parts that is representative of the holographic phenomenon of the human body. By observing the color changes of different parts of the nose, pathogenic changes can be detected in the viscera that corresponds to that part of the nose. The nose of a healthy person is bright and pinkish, similar to that of the ears, although with slight differences in shade. In addition, it is shiny and without pimples or bumps. If an ailment develops in the body, the color of the nose will change. The darker the nose, the more serious the ailment. Here we have a picture of a red-tipped nose. When the tip of the nose is red, it suggests excessive heat of the spleen and lungs. When it is slightly red, it means there is deficient heat of the spleen meridian. When the edge of the nostril is red, it indicates ailments in the intestines. Here we have a yellowish nose. When the nose looks yellow, it means there is damp heat in the body. If it is combined with a yellow color in the face and eyes, it is symptomatic of jaundice and is often seen in acute jaundice hepatitis. And here in this illustration, we see a pale nose. This is often a sign of deficiency of qi and blood. If the tip of the nose is pale with white millet-like bumps, this often indicates irregular menstruation. Here is a bluish black tipped nose. This is a sign of pain, often abdominal pain. Women with a great volume of dark red menstrual blood often experience painful menstrual periods. Now here we have a bluish nose. Scholars have found that people are likely to have the onset of ailments with the spleen and pancreas when their noses look bluish, brown, or black. Thank you for your